Hi, and welcome back to A Guide to Mental Illness. Today we're going to be talking about depression, obviously, and treatments for depression and or coping mechanisms. So depression, if it's moderate or not as severe, you can do a lot of self-help or talk therapy, psychotherapy, where you just talk about your feelings and find your triggers. You can also do a lot of self-help, which is like, exercise, sleeping a lot better, changing your lifestyle, doing things that you wouldn't naturally really do, but try to get into a new cycle of just doing healthy things to do. You can also do journaling. Therapeutic journaling also helps a lot of people, where you just kind of write about your day or your emotions or your experiences, and over time things just tend to, like, you find patterns and realize what's most helpful for you to be continuing. But for people that have like moderate to severe depression, they can still do these coping mechanisms, but for them you're gonna need a little more. So for moderate to severe depression, you would either take antidepressants, which is medication. A lot of people don't want to stay on them because they feel like they're going to get too addicted to them. And that's the downside of taking antidepressants. But they are medicines to treat depression if a person's willing to do it and they talk to their medical provider about it. You also obviously have to be prescribed these. And then you can also do therapy as well, and then also talking therapy for people that want to like combine them. And then in more severe cases there is like alternative forms of therapy. One of them is electroconvulsive therapy, where electrical currents are passed through the brain to impact the function and the effect of neurotransmitters in your brain to relieve depression. It's usually used for people who don't get better with medications, can't take antidepressants for health reasons, or are at high risk of suicide. So this is kind of like one of the last form of things that people will do, because it's not as morally correct in some people's eyes. There's also transcranial magnetic stimulation. This is an option for those who don't respond to antidepressants. A treatment coil is placed against your scalp, sending a brief magnetic pulse to stimulate nerve cells in your brain that are involved in mood regulating depression. So basically, like, they just place a coil and it kind of just sends like vibrations and signals saying like, hey, stop thinking so badly, like, just happy mood, trying to get all those happy juices flowing. But as I said, people really don't rely on these because they think it's not morally correct to do this to a person, but if it is a last option, medical providers will resort to this. But there's also a lot of other forms that don't have to go this severe, as I said. There's coping mechanisms that people can try doing, exercising, running, biking, any of that, just to get their mind off of things and kind of just getting into a healthy regimen. You can also talk to other people, friends, family, journaling, or even taking up an art, doing drawing, singing, tends to help a lot of people, reading or writing, just in general. There's also other forms where you can go see a psychiatrist or do counseling sessions with somebody to kind of get like into these moods of like where you're repetitive and you start doing a lot of more activities by yourself. Try to just to help yourself relax and calm down instead of always wanting to do things like in a very negative or like bad manner, or try to be productive as well. A lot of like these coping mechanisms try to make people productive. Pets is also another form of therapy. Having a pet has proven to reduce stress in some people, and it's also proven to send happy signals to people and kind of like alleviate a person from not feeling so depressed. Having to take care of another being gets people to get up and be productive because they don't want to have their pet die on them. Or even taking care of plants. Gardening is another way. You have to take care of something, and in turn you start realizing to take care of yourself, because with them growing, you're also growing as well as a person. So those are some ways that people can cope with depression and use mechanisms or treatments to help possibly lessen the symptoms of their depression, depending how severe or moderate they are. Thank you for tuning in.